Hello everyone, welcome to the SMA Victor. In today's video, we're going to break down exactly how Evrysdi, one of the most recent treatments for SMA, works. We'll look at what Evrysdi is, how it helps people with SMA, and why it's become such an important option for SMA treatment. So let's get started. So what is Evrysdi? First off, let's talk about what Evrysdi is. Evrysdi, also known by its scientific name risdiplam, is an FDA-approved treatment for SMA. Unlike some other SMA treatments, which require a hospital visit for injections, Evrysdi is an oral liquid medication that you can take at home. It's usually given daily, making it a convenient option for people with SMA, regardless of their age. Evrysdi comes in a liquid form that is taken orally, which means it's a lot easier to administer, especially for children or individuals who may have difficulty with invasive procedures like injections. But what exactly does this medication do? Let's take a closer look at how Evrysdi works in the body, the science behind SMA. Before we dive into how Evrysdi works, it's important to understand a bit about the biology of SMA. SMA is caused by mutations in the SMN1 gene, which is responsible for producing a protein called survival motor neuron, or SMN protein. This protein is crucial for the health of motor neurons, the cells that control muscle movement. When the SMN1 gene is faulty or missing, the body can't produce enough SMN protein, leading to the death of motor neurons. This is why individuals with SMA experience muscle weakness and a decline in motor function. Now, our bodies have a backup gene called SMN2, but the problem is that SMN2 doesn't make enough functional SMN protein on its own. That's where Evrysdi comes in. How Evrysdi boosts SMN protein levels. So how does Evrysdi help? Evrysdi works by modifying the way the SMN2 gene functions. Normally, SMN2 produces a small amount of SMN protein, but most of it is incomplete and non-functional. Evrysdi changes this process, encouraging the SMN2 gene to produce more full-length functional SMN protein. In simpler terms, Evrysdi turns the SMN2 gene into a more effective backup of the missing or faulty SMN1 gene. It boosts the production of the SMN protein, which in turn helps protect motor neurons and slows down the progression of SMA. This means that individuals taking Evrysdi can experience improved or stabilized muscle function over time. Who can take Evrysdi? One of the great things about Evrysdi is that it's approved for a wide range of people with SMA. From infants as young as 2 months old to adults, Evrysdi can be prescribed to manage the condition. This broad approval makes it a versatile option for families dealing with SMA, especially since it's a treatment that can be administered at home. For infants and children, Evrysdi offers a way to start treatment early, which is crucial because early intervention has been shown to have better long-term outcomes for people with SMA. And for adults, Evrysdi helps maintain motor function and prevent further decline. The benefit of taking Evrysdi. Now that we understand how Evrysdi works, let's talk about the benefits. One of the biggest advantages of Evrysdi is that it's non-invasive. Unlike treatments that require spinal injections, Evrysdi is taken orally, which makes it more convenient for patients who may already have complicated medical needs. Another key benefit is that Evrysdi is designed for long-term use. By constantly boosting SMN protein production, it can help slow down the progression of SMA and even improve motor function in some patients. Clinical trials have shown that Evrysdi improves or stabilizes muscle function, which can make a big difference in the life of people with SMA. Are there any side effects? Of course, like any medication, Evrysdi comes with potential side effects. Some of the most common side effects include fever, diarrhea, and skin rashes. These side effects are generally mild and tend to decrease over time as the body adjusts to the medication. In rare cases, more serious side effects like respiratory infections or issues with liver function have been reported. That's why regular checkups and blood tests are recommended, especially during the early stages of treatment to monitor any potential complications. Long-term outlook with Evrysdi. So what can you expect from long-term use of Evrysdi? While it's not a cure for SMA, Evrysdi can make a significant difference in the progression of the disease. By boosting SMN protein levels, it helps preserve motor neuron function, which is critical for maintaining muscle strength and mobility over time. For many individuals, Evrysdi has provided noticeable improvements in muscle function, or at the very least slowed down the loss of motor abilities. The key is consistency. Taking Evrysdi every day as prescribed can help manage the symptoms of SMA in the long run. Final thoughts on how Evrysdi works. In conclusion, Evrysdi is a game-changing treatment for people with SMA because it addresses the root cause of the disease by boosting SMN protein levels. It's an easy-to-administer, non-invasive option that can be taken at home, making it accessible to a wide range of individuals. While it's not a cure, it's a powerful tool in the fight against SMA. If you found this video helpful, make sure to give it a thumbs up, share it with your friends, and hit that subscribe button for more content on SMA treatments and awareness. Thank you so much for watching. We'll see you in